Hi everyone, welcome to Chapter 12. In this chapter we're going to look at psychological disorders. And when people think of psychology, this is where their mind tends to go to, thinking about the disorders that people might have. And there's, as you know at this point, so much to the field of psychology. This is just one part of it, but this is an interesting part of it to see what type of behaviors are not considered typical and where people believe that some type of intervention is needed to help people live more fully in their daily lives. So let's look at some of this information. Psychological disorders are behaviors or mental processes that are connected with various kinds of distress, and there's some type of significant impairment in daily functioning. Now, psychological disorders can have various combinations of different characteristics. So they are unusual, such as an unpredictable panic attack. They could suggest a faulty perception or interpretation of reality, such as hearing voices or seeing things, and these are called hallucinations. They tend to suggest severe personal stress, such as anxiety, where we have exaggerated fears. They're self-defeating, meaning that they can cause misery rather than happiness and fulfillment. They can be dangerous. They can be hazardous to ourselves or to others. And some of the behavior can be seen as socially unacceptable. In order to standardize diagnoses, the Diagnostic and Statistical Manual, or the DSM-5, is used. And this manual classifies psychological disorders, and it was compiled by the American Psychiatric Association. So this is the manual that clinicians use when they're working with clients to determine if there is a disorder and what the criteria are needed to give a diagnosis. About half the population will meet the criteria for a DSM disorder at some time in their lives, and a lot of the disorders will begin in childhood or adolescence. About a fourth of our population experiences psychological disorder in any given year, and women tend to have higher rates of anxiety and mood disorders, and men are more likely to have substance abuse disorders. So let's look at some of the disorders. Anxiety disorders have a psychological response and also physical symptoms. The psychological symptoms can include worrying, fear of the worst happening, fear of losing control, some type of nervousness, or the inability to relax. Anxiety is essentially the fear of something that might happen. It's a fear of something that's going to happen in the future. And the physical symptoms that go with anxiety include trembling, sweating, racing heart, elevated blood pressure, maybe a flushed face, and feeling faintness. Anxiety is an appropriate response to a real threat. So if you're encountering a dog on the street and the dog is growling at you and it looks like it's ready to attack you, that is a good time to have anxiety. There is a real threat there. But anxiety becomes abnormal when it's excessive, when it comes out of nowhere, when all of a sudden you're worried, what happens when I drive home today, or what happens next week when I make a presentation. And those type of anxieties tend to prevent people from living a healthy and happy life. Now, anxiety disorders have specific disorders under them, including phobic disorders, social anxiety disorder, panic disorder, and generalized anxiety disorder. A specific phobia is an irrational fear of a specific object or a situation. So maybe an irrational fear of spiders, irrational fear of going into a certain classroom. Claustrophobia is fear of tight, small places, such as getting on an elevator. Acrophobia is fear of high places. Agoraphobia, fear of open, crowded places. And social anxiety disorder, an irrational fear of public scrutiny. So this is real common. It can be real common in teenagers who are afraid if they go to school, they're going to be made fun of. Or if they eat at lunch, somebody's going to make fun of how they eat. And that can create social anxiety disorder. A panic disorder is a sudden anxiety attack, typically unrelated to a specific object or situation. So if you're sitting in class and then all of a sudden you feel yourself starting to panic and nothing was going on in class to create this fear, that could be considered a panic disorder if it goes on to include shortness of breath, heavy sweating, tremors, and pounding of the heart. Panic disorders can also make people feel like they're suffocating, that they're choking, nauseous, flushes and chills, and fear of losing control. And many people end up going to the hospital, to the emergency room, when they're having panic disorders because they truly feel like they're going to die, that something is detrimental is happening. Generalized anxiety disorder is just persistent anxiety. It can't be attributed to any specific thing, but there's just always this constant feeling of anxiety. It has to have occurred for at least 6 months of duration before it can receive the diagnosis of being generalized anxiety disorder. And some of the symptoms can be motor tension, autonomic overarousal, and excessive vigilance. So always being on guard in case something happens. There are different thoughts to the origins of anxiety disorder. The psychological view feels that phobias are conditioned fears. So we learn to be afraid of things. Maybe we watched our parents be afraid of things, and by observing them, we too took on that fear of certain things. And then our appraisal of the magnitude of threats. So if you're walking with somebody and again the dog is there threatening y'all, it might create anxiety for you, but for your friend, they might just tell the dog, go away, and the dog goes away. So again, it's our appraisal of the situation. The biological view looks at the genetic factors related to anxiety. And if parents have anxiety, there's a higher chance that children will also have anxiety. The biopsychosocial view sees anxiety as the interaction of biological, social, and psychological factors, and all of these come together to create anxiety. Obsessive-compulsive disorder is another disorder that can be found in the DSM-5. Obsessions are recurrent anxiety-provoking thoughts or images that seem irrational. So the fear of germs, the obsession with, I can't touch this, or I might get germs, and I might get sick, and I might die. Oftentimes we see people who don't want to shake hands with others because of their obsessive thoughts of getting germs. Compulsions are urges to engage in thoughts or behavior that tend to reduce anxiety. So if I'm afraid of germs, if I have those obsessive thoughts, then I'm going to wash my hands continuously, or I'm going to carry around a bottle of hand sanitizer and use it every 5 minutes just to be sure that I don't have any germs on me. Now, all of us, or not all of us, but a lot of people have some degree of obsessive-compulsive disorder. For instance, if you are leaving your house and then you wonder, did I hit the button and close the garage door? And you have to go around the block and check just to make sure the garage door is closed or you left the door locked. That is an obsession, the thought of, oh my gosh, I left my house unlocked. And the compulsion then is to go back and check. But it really becomes a problem when it interferes with daily life. And that's when people tend to seek treatment because they maybe are late to work every day because every day they're having to go back and check. Or they're having to go back into the house and make sure they didn't turn off the gas burner. So it's behavior that starts to disrupt daily life that causes a problem with OCD. People with a hoarding disorder feel an overpowering need to accumulate certain kinds of possessions, and they have a difficult time letting go of them. And you may have seen TV shows on hoarding. And this is related to anxiety. So there's other types of disorders in addition to hoarding disorders, including body dysmorphic disorder, and that's a preoccupation with exaggerated or imagined physical defects. And these people often have multiple plastic surgeries to fix all the defects they think that are making them look hideous. And there's also continuous hair pulling and compulsive skin picking. Post-traumatic stress disorder, or PTSD, results from a traumatic experience. And oftentimes we think of this of people in war who go to war, they suffer PTSD when they return home. But it also can be rape victims. It can also be people who are in car accidents. It can be children who were traumatized when they were younger. So PTSD is characterized by rapid heart rate and feelings of anxiety and helplessness. So the traumatic events are often reimagined in the forms of memories and recurrent dreams and flashbacks. And it's a feeling that the event is reoccurring and happening in real time. So people with PTSD typically try to avoid thoughts and activities that connect them to the traumatic event. And they find it more difficult to enjoy life and often have sleep problems, irritable outbursts, and difficulty concentrating. And people with PTSD sometimes become extremely vigilant and always are on guard, always aware, worried about the next thing that might happen. Acute stress disorder is similar to PTSD in that there are feelings of anxiety and helplessness that are caused by a traumatic event. An acute stress disorder occurs within the month after the event occurs and lasts for about 2 days to 4 weeks. So it's a short time span where we're feeling anxious and helpless because of a traumatic event. So if you witness somebody getting injured, then that might leave you with this stress disorder where you're just feeling anxious and helpless. But after about 4 weeks, it starts to die off and you start feeling back to your old self. If it continues, though, beyond 4 weeks, it can become characterized as PTSD. Somatoform disorders are disorders where people complain of physical problems when there's no evidence of any physical issues. And this could include paralysis, pain, or persistent belief of a serious disease. These people may insist that they're sick, and they can become preoccupied with minor physical sensations and continue to believe that they are sick, even though physicians tell them no, they're healthy. So they might go from doctor to doctor trying to find someone who will diagnose them with some type of illness. And this fear of illness can disrupt their work and home life. A conversion disorder is a major change or a loss of functioning in the person, even though there is no medical findings that can explain the loss of functioning. So these behaviors aren't intentionally created, so the person isn't faking it, but it does create some sort of physical difficulty for the person. Mood disorders are another type of disorder that we commonly hear about, and these are characterized by severe or prolonged disturbances in an individual's feeling states. In other words, the moods are impairing the person's ability to function daily. So people with mood disorders have disturbances in their moods that are unusually severe. They can become severely depressed, or they can have extreme mood swings. People who have extreme mood swings may be experiencing bipolar disorder. These are mood swings from ecstatic elation to deep depression. So then in the elated phase or the manic phase, the person shows excessive excitement or silliness, maybe carrying jokes too far. The manic person can be argumentative, show poor judgment. They can destroy property, make huge contributions to charity, give away expensive possessions, clean the house excessively, maybe cook a bunch of things. They're just too restless to sit still and to sleep. These people often speak rapidly and jump from topic to topic. After the manic phase ends, they fall into depression. And depression is the other side, where they're feeling lethargic, they can't sleep, and they're extremely agitated. So they can cycle through being in their manic phase and then their depressive phase. We all have times where we're feeling a little down, but that it usually doesn't last. We can snap out of it and get back to feeling like our old self. But people with depression may chronically feel sad or blue or down in the dumps. They complain of lacking energy, not feeling good about themselves, have difficulty concentrating, and not be interested in normal activities that they used to be interested in. They can also just be crying a lot and even have thoughts of suicide. And when the feelings are really intense, they can be diagnosed with major depressive disorder. And major depressive disorder includes also symptoms of a poor appetite, serious weight loss, and agitation. Sometimes it can include psychotic behavior, such as delusions of unworthiness, guilt for imagined wrongdoings, and the belief that the person is rotting from disease. So the origins of depression and the psychological view feels that people lack reinforcement and have an external locus of control. So they depend on people outside of themselves to determine how well they are doing. And they have found links between depression and learned helplessness. And learned helplessness is feeling like a victim, like there's nothing I can do, everything happens to me. Cognitive factors that can contribute to depression include being a perfectionist and having unrealistic expectations. So if you expect yourself to be the best and you don't meet that level, then you can fall into a depression. An attributional style is the tendency to attribute our behaviors to internal or external factors. So we're attributing what happens to something outside of our control. The biological view sees depression as associated with neuroticism, which is connected to anxiety, and for a lack of the neurotransmitter serotonin, which helps us feel better. So medical treatment would be taking medication that helps activate the neurotransmitter for serotonin, and people with severe depression often respond to these types of drugs. So there can be many types of situations that cause depression. The death of somebody, extreme stress, Physical discomfort, being in constant pain, feeling a lot of pressure at work can all lead to depression. But people who stay depressed often have a lower self-esteem and are less able to solve their social problems and have less social support. Suicide attempts can be the result of extreme depression, and it's the leading cause of death among 15 to 24-year-olds. Suicidal adolescents tend to be more confused about who they are and where they're going. They tend to be more impulsive, have emotional instability, and social problems. Having family members who have tried to commit suicide or have committed suicide, or family members with psychological disorders, can increase the risk factor for suicide. Suicide isn't connected only with feelings of depression and stressful events, but it can also be influenced by age, educational status, ethnicity, and gender. Suicide tends to be more common among college students than among people with the same age who are not in college. And each year, about 10,000 college students attempt suicide. Although we often hear about teenage suicide, older people are also more likely to commit suicide. The suicide rate among older, unmarried, or divorced people is double that of older married people, so marriage is a good support system for people, and it lessens the risk of suicide. There are some myths involving suicide. Most people who commit suicide give some type of warning about their intentions, or they've made previous attempts. And discussing suicide with a person who's depressed does not encourage them to attempt suicide. That is an intervention that is beneficial for them. And trying to get somebody to promise not to commit suicide before calling seems to prevent some suicides. Suicidal thinking is not necessarily a sign of psychosis or personality disorder. Instead, some people may simply consider suicide when they think they have run out of options. Just the thought of committing suicide provides them with some type of relief. So having a really strong support system and interventions makes a tremendous difference in helping people from trying to commit suicide. If you have thoughts of suicide, or you know of somebody who speaks about suicide, there are some contact numbers available on this module, so I strongly encourage you to reach out to someone to find out what to do, either for your own safety or for the safety of your friend. Schizophrenia is another disorder, and this one is less common than the other ones we've been talking about. Schizophrenia is a severe psychological disorder that's characterized by disturbances in thought and language, perception, motor activity, and mood. And people who are schizophrenic can withdraw and be absorbed in their daydreams or fantasy life. Symptoms in schizophrenia can be positive or negative. Positive symptoms mean the presence of inappropriate behavior, such as agitated behavior, hallucinations, delusions, disorganized thinking, and nonsensical speech. Negative symptoms are the absence of appropriate behavior, such as having a flat or emotionless voice, a blank face, rigid or motionless bodies, and mutism. Schizophrenia has been called a thought disorder because people with schizophrenia may have problems in thinking, language, memory, and attention. Their speech may be jumbled, and they might jump from topic to topic when they're talking to you, and they're actually giving you very little useful information. They're just saying a lot of words. They usually don't recognize that their thoughts and behaviors are abnormal. And many people with schizophrenia have delusions of grandeur or feelings of being persecuted. So in delusions of grandeur, a person may believe that he or she is a famous historical figure. People with delusions of persecution may feel like they're being followed or the FBI is out to get them. And people with delusions of reference believe that other people are talking about them all the time or referring to them. People with schizophrenia often have problems with perception. So this includes hallucinations, an imaginary thing that's occurring, and they can't distinguish the hallucination from reality. So people with schizophrenia may have auditory hallucinations, which is the most common type, where they're hearing things that aren't really there. They're hearing voices, or they may see colors or obscene words spelled out in midair. In their activity, their movements may become wild or so slow that they seem to be in a stupor, a condition in which thoughts and movements are inhibited. They may make strange gestures or facial expressions, and they also may have a condition called catatonia, which is a striking impairment in the motor activity, where they just are not moving at all. Their emotional responses may be flat or blunted, and they may withdraw from others and isolate themselves. Another type of disorder in this family is delusional disorder. And this is a disorder where people hold persistent delusional beliefs, usually involving paranoid. So the world is going to end, the government's out to get us, my neighbor is trying to attack me all the time, and they don't show any other obvious odd behavior. They just have these paranoid thoughts. So schizophrenia is attributed to many factors. It includes differences in the brain structure. People with schizophrenia have less gray matter than other people. They can have smaller brains and lower level of activity in the prefrontal cortex. There's also a genetic component to schizophrenia. It could result from complications during pregnancy and birth, poor maternal nutrition, and people have even suggested those born during the winter are at a higher risk for schizophrenia. The biopsychosocial model of schizophrenia shows all the factors that come together that can create this disorder or causes this disorder to be expressed in a person. And you can see under the biological factors, genetics, differences in brains, viral infections. Psychological factors is unusual stress and problems at home. And the sociocultural factors include poverty, poor quality parenting, and malnutrition. Right, another type of disorder is personality disorders. And the personality disorders, like personality traits, are characterized by patterns of behavior. So these are patterns of behavior that don't change over time. They're pretty consistent. Personality disorders, though, are behavior that are inflexible and maladaptive. It doesn't work in daily life. And these behaviors impair personal and social functioning, and they're likely to create distress for the individual, or if not for the individual, to other people around the person. There are different types of personality disorder. One is paranoid personality disorder, which is a tendency to interpret other people's behavior as threatening or demeaning. People that have this disorder are mistrustful of others, and their relationships suffer because of it. A schizoid personality disorder is characterized by an indifference to relationships and having a flat emotional response. So people with this disorder are often loners. They don't develop good relationships with other people or good feelings with other people, but they don't have hallucinations or delusions. This is different from schizophrenia. Schizotypal personality disorder generally means an oddity of thoughts and perception of behavior, such as excessive fantasies or being extremely suspicious, feelings of being unreal, or an odd use of words. There's no complex delusions or hallucinations, and there's usually no motor activities such as you find with schizophrenia. So this disorder is schizotypal. It's not schizophrenic. The antisocial personality disorder is actually one of the most studied personality disorders because a lot of these people find themselves in prisons. And so that's a place where researchers can go and really study the causes and the treatment for antisocial personality disorder. People with this disorder often show superficial charm and are at least average in intelligence, but they don't have a strong bond with other people. They are often heavily punished by their parents and rejected by their peers, and they continue their impulsive behavior into adulthood. Antisocial personality disorder is more common among men than women. People with borderline personality disorder often have unstable relationships. They lack control over their impulses. They're often uncertain about their values and their goals, their choice of friends, and they tend to view people as either all good or all bad. People with borderline personality disorder tend to either be angry or irritable, have depression and anxiety that can last a few hours or a few days. And they have trouble controlling their anger, and they tend to get into fights or to smash things. They can be impulsive and unpredictable. And lastly, avoidant personality disorder are people who generally are unwilling to get into relationships unless somebody can reassure them that they will be accepted, because they have a strong fear of rejection and criticism. They have interest in people and they have feelings of warmth toward people. They just have an extreme fear of being rejected or criticized. So there can be a genetic factor with personality disorders. Since personality traits may be inherited, the disorder itself may be passed on through generations. And they can also have less gray matter in the prefrontal cortex for those who suffer from antisocial personality disorders. There's a belief that childhood experiences play a big part in developing personality disorders. And again, those with antisocial personality disorders tend to misinterpret other people's behaviors. And lastly, for sociocultural factors, having a loss of community or not having a good support system can contribute to the development or the expression of personality disorders in people. Okay, so we went through a lot of disorders in this one chapter. If you're interested in learning more about the disorders in the DSM-5, then take the abnormal psychology class that's offered in the Department of Psychology. This class explores all of these different types of disorders in more depth and gives a lot of good information for people. And as I said earlier, if you know of somebody who's struggling with depression or who talks about suicide, or if you yourself are struggling, please reach out. There is the National Suicide Prevention Lifeline that is available 24/7. And locally we have the crisis line at the Center for Healthcare Services, also available 24 hours a day, 7 days a week. And as always, the University Counseling Center or St. Mary's University and Our Lady of the Lake also have counseling centers. That is it for this chapter. Reach out to me if you have any questions. I'm more than happy to talk to you about any issues that might come up. And I hope you have a great week.